Hi Don, my name is Joel. I'm a physical therapist. It's good to meet you.
Hello.
So I understand you have some pain today. I just want to educate you a little bit about your pain and about where you can expect it to go from here. So pain is difficult to understand, but I'm going to try and explain it to you here. Um, it starts off. There's a lot of different kinds of pain. You step on a nail, your body is gonna look down. Have you ever stepped on a nail, Don?
Yeah, I have.
And what did you do?
I kind of just pulled away from it, and yeah.
And did it hurt
Yeah.
at all?
Yeah, it did. It took for a short time. I just felt the prick, and then after a while, I felt the pain. Yeah.
Yeah, and that's normal. That's your body's response is to feel pain. That's what lets you know that there's a nail there and you need to pull the nail out. And it's normal that you had some pain afterwards. The body's still looking around, making sure that you don't step on any more nails, so that you're being reminded consciously that you did just step on a nail. Be careful. So you are going to have pain a little bit afterwards. There's about 45 miles of nerves in your body, and nerves work kind of like this. So they're just happily buzzing along, and then you go and you step on a nail, and the nerves send the signal to your brain, and once it reaches a certain threshold, we'll call this the pain threshold, that's when your brain sends a signal that you have pain. Your brain is what's in charge of your pain. So as long as that signal doesn't make it to the brain, you won't have pain. Let's say you're out in the yard, you're working, you come back in, you have some cuts on your hand. You had an injury, but you didn't have any pain. So that's another thing to illustrate is that pain does not equal injury. They occur separately. You can have pain with no injury, and you can also have an injury with no pain. Like, for example, when you're working out in the yard and you notice that you have a scratch. So a lot of the times, it's very typical for patients, possibly in your scenario, you didn't actually have a specific injury for your pain, and that's completely normal. Don't let anybody ever tell you that you're not experiencing your own pain. But to go back to this illustration here, once your nerves reach a certain threshold, your brain's going to send that signal for pain. And so right here you're saying, ow, 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 it hurts. And then eventually, in a matter of minutes, possibly even days, those nerves will calm back down. And so that's more of like an acute situation, an acute scenario. It's more short term, to put it in your terms. Now, if that problem persists, let's say that you step on the nail and for days, months, years, you still have pain in your foot, that's an example of chronic pain. It can be tough to deal with, and I think that it's important that you understand this so you can get a better grasp on that and understand possibly where your injury is coming from. I'm just going to show this to the camera real quick to see what we have here. If it'll focus, there it goes. So one more thing that I want to reiterate is that the pain is yours, you own it. I hope you have a better understanding of where it can come from, and that it can take time for these nerves to resolve, or for these problems to resolve, and that sort of thing. So if you have any questions for me, go ahead and ask them. I know it can be a tough concept to get a hold of for you as a patient.
Mhm.
But yeah, if you have anything that you want to say at this time, feel
Yeah,
free.
I've met with a physician before, and I told them about this chronic pain that I've been having, and
Mhm.
they kind of just disregarded it. Um, and so I was wondering what I should do in that situation.
Yeah, that physician. It's unfortunate that they said that to you, because it is your pain, and you do experience it. So if somebody's not willing to understand that and listen to what you have to say, um, you might want to think about looking at other options, and going to somebody that will be there for you to help you cope with this.
Okay,
Okay.
sounds great.
All right. Anything else we can do besides get started?
No,
All right.
let's do it.
All right. Thank you, Don.